Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And today we have with us another special guest. And this is someone you actually know, folks, Courtney Turich. Courtney started with a company called Cooler Heads, about 3 or 4 years ago. And when we had our first episode, she had just introduced what was going on, what they were about to do. We had an episode with the CEO, with some of her mentors. It was amazing. And now, a whole 3+ years later, full team, global reach. I mean, it's amazing. This is an episode you don't want to miss. If you're someone that's in the industry and you've been thinking about making your next move, and you're thinking about startup versus continuing with the company, you have to listen to this episode. And if you're someone that wants to get into the industry, and you've always wondered, I want to do medical sales, but I want to enterprise myself. I want to go in with a bang, and I want to see how far I can take things. Again, you got to listen to this episode. As always, we do our best to bring you guests who are doing things differently in the medical sales space. So I really do hope you enjoy this interview. Courtney, how are we doing today?
I am good. I'm so happy to be here with you, Samuel.
Yes.
It's been a while.
It's been a long while. I mean, we haven't spoken for what? 2 years? A year and a half? 2 years?
That's what I'm thinking. I'm thinking 2 years.
2 years.
Which is crazy.
Unbelievable. When I spoke to you last, Cooler Heads was brand spanking new. You guys were making a lot of progress. I just met your CEO. You guys had literally like the bare bones of your leadership team was putting together. So let's just get right to it. Everybody wants to know, where the heck are you guys now?
Oh my gosh. Boy, a lot has changed in 2 years. So Samuel, when we first talked about Cooler Heads, so everybody out there who knows Cooler Heads, we have a device that helps to minimize hair loss for chemo patients. So allowing them to have privacy, identity, and a sense of self during a really difficult time. I joined this company before we commercialized. So there was nothing in the field. Honestly, we didn't even know that the system worked, Samuel.
Wow.
Yeah. So I jump in because I just love the startup environment, the challenge, and it was time to hit the ground running. We had to commercialize. So I get out there. It's me and my mentor. We're running across the country trying to sell this device that, again, has never been used, but we know it works. Well, we know it works because it got FDA cleared, but we never really used it on a patient. It works on patients. We're thriving. Since we last spoke, we now there's 8, a lot of us reps, more than 8 across the country.
Wow.
Out in the field.
Wow.
Selling AMA. We're in over 100 infusion centers. Some huge names, like really big accounts I wish I could share with you, but we span from the East Coast to the West.
So let's talk about it,
Yeah.
And I love what you said. When I talked to you last, it was literally you and your mentor. 3 people, the CEO, you and your mentor. Yeah. And you guys were putting together a leadership team, and now you have a team of over 20 people. What was it first? Was it that people just started getting this product and saying, we love it, let's go? Or was it the promise was so big and the demand, the sales weren't there yet, but the demand and the curiosity was growing? What was it that said, okay, we need to expand this, we need to expand fast?
Right. So multiple factors. When I first started with Cooler Heads, the awareness really wasn't out there yet. Okay. And I will tell you, in the past 3 years, it has dramatically changed. Like, patients are becoming more aware of their options through social media, through influencers, right, who have had cancer, who are promoting scalp cooling. We're not the first product on the market. We're the newest, most innovative. But what makes us unique is that we are the first small and portable system that can easily navigate through infusion centers that are already busting at the seams.
Got it. Okay.
Right.
So then would you say that competitors drove what allowed you guys to get to where you are today? Meaning just the space in general, people looking for scalp, hair options that have cancer, they're looking for it, and that's what drove it? Or competitors actually marketing their products and people seeing theirs and saying, we need something better, and then discovering you guys, how to happen?
I think it's a little bit of all that,
Okay.
Samuel. While they started making the noise by us coming to market, when you bring competition to the market, it elevates everyone.
Right.
It makes
Right.
everyone have to play bigger. And so we started making noise, they started making noise,
Gotcha.
patients were making noise.
Gotcha.
Don't ever underestimate the noise a patient can make,
Yeah. Yeah.
because you find that right passionate person
Yeah.
and they will scream it from the mountaintop what they need.
So
And we
tell me,
leverage those patients.
tell me about your first success story then, because when I talked to you, you said you hadn't really tried it on a patient yet. I want to hear when you first tried it on an actual patient, the success. Okay, when you first decided to try it on a patient, and then what happened that made you guys say, "Oh my gosh, here it is. This is what we've been working so hard to get into the hands of these patients."
Right. So let me rewind. When I say we haven't used it on a patient, the science is behind it, right? Like we know what helps to minimize hair loss for chemotherapy patients,
Right.
which essentially is cryotherapy for the scalp. We're freezing the hair follicles from the chemotherapy from penetrating in and killing off the hair follicles.
Right.
Granted, every chemotherapy regimen acts differently. Every person's hair reacts differently. My hair's different than your hair,
Sure.
Samuel.
Sure.
Our genes are different, just our entire makeup. There was a lot that goes into hair retention.
Fair.
So we knew theoretically the technology worked. One of the biggest success stories at the beginning was we had a patient who was a gynecologist. She delivers babies for a living. She's in private practice. She gets diagnosed with cancer. She wants to keep it private because what doctor or patient wants to walk in, see their gynecologist sick, no hair, going through cancer, but hey, you're going to be here to deliver my baby in 9 months?
Right.
It's a little scary. But at the same time, she had to continue to make a living. And she had kids at home where she didn't want them to look at her and say, oh, she's sick. My mom's sick.
Right.
This woman went through her whole chemo regimen without her labor and delivery team knowing and her office staff knowing
Wow.
until the very end. That's incredible. That
Mm.
gave her privacy,
Yeah.
identity, and the ability to tell her illness on her own terms.
Sure.
That's remarkable.
When she first was introduced to the product, was she just like, give it to me? Or was there a reservation? Or had she already done her research? What was the context?
Yeah, another great question. She had done research on scalp cooling. She approached us. We didn't have the device at her infusion center,
Okay.
but she is an example of where her voice mattered. She made it known that she had to have this device. She took it up to the leadership at the hospital, and we were able to get that system in the hospital for her to use and other patients from that point forward.
Wow. Remind us again, Courtney, when you're put on this product, what's the expectation here? What patient has no hair, they discover cooler heads. What are they told? What do they expect? And what actually happens? And how long does it take?
Yeah. So patients have to start with their very first chemo
Okay.
regimen. So they can't start chemo and then start scalp cooling. They have to start scalp cooling from day one. Because if they don't, after the first round, their hair follicles are already damaged.
Okay.
Okay. Scalp cooling is not black and white. Everybody's going to lose some hair. They're
Sure.
going to shed, right? So we set those expectations up front with the patient. One thing we do differently than anyone else on the market is we really take education as a priority for the staff at the infusion center, but for the patient.
Right.
So when a patient decides to move forward with cooler heads, they actually get trained by our clinical team, which is comprised of nurse navigators in the oncology space.
Sure.
So we deploy an online training platform that the patient does to walk them through what to expect on their first day of chemo and also what to expect with scalp cooling. And then secondly, they do a virtual call with our nursing team to walk through, hey, do you have any questions before you walk in that first day? So our goal is when they walk into that first day of chemo, they're armed and ready to go independently without burdening the staff.
Wow.
Because as you know, Samuel,
Yeah.
I mean, resources are limited everywhere in these
Wow.
facilities anymore.
How long was her treatment, this patient?
Everybody's regimen is different. It can be 4 weeks, it can be 8 weeks, it can be
Sure.
16 weeks. I can't remember. I think hers was 12. The one thing about scalp cooling, so they do it for every chemo session they go in for. They have to pre-cool for 30 minutes before they get their chemo injection.
Okay.
They do it during their chemo injection,
Okay.
and then they do it 2 hours post.
Sure. Wow. So for
Yeah.
12 weeks, her whole
Yeah.
team just clueless because of cooler heads.
Yeah.
Unbelievable.
Wild.
Unbelievable. So how many patients now have been on it since I saw you last, or since that patient, since I was your first patient?
We've had over 1,000 patients. Yeah,
Yeah.
right.
Oh, wow. And so today, is it, I mean, you guys have a big sales team. I mean, and
We
you
do.
developed in such a small time. Is it
Yeah.
because you cannot meet the demand fast enough? Or is it because as soon as someone knows about this, they're like, yes, please?
So there's a few things. We're a
Okay.
medical device company, right? We're here for super growth,
Okay.
right? We want a lot of growth.
Right.
We're out here to hit the market
Right.
hard and
Right.
make scalp clean available to everyone.
Right.
Secondly, scalp clean is moving to a CPT-1 code, which is huge. So Medicare is going to officially start recognizing scalp cooling as
Wow.
a actual
Yeah.
medical device that's needed for
Yeah.
patients.
Wow. Wow. We talked about it a little last time, but I want to hear if it's changed. What is the usual reception from a physician, an oncologist, when you guys introduce yourselves?
Yeah. It can be hit or miss. And reality is, I believe it's hit or miss because scalp cooling is not black and white, because it can vary depending on patient to patient,
Okay.
right? Those outcomes. You're going to get some oncologists that are like, I'm going to give my patient anything and everything they need or want to try.
Sure.
And then you're going to have others that say, we're not going to waste our time on that. But reality is, if you think about, a lot of our patients are breast cancer patients. Scalp cooling can be used for any patient who has a solid tumor. A patient gets diagnosed with breast cancer. In 30 days, they can lose their breasts and then their hair. And most of them get thrown into menopause.
Right.
So when they go look at themselves in the mirror, they are a shadow of what they used to be.
Right.
So if we can give them one thing that gives them some normalcy, which is their hair, to go out in public, to go to the grocery store
Sure.
and not be looked at by people to say, oh, I'm so sorry she's sick. I hope she's okay.
Sure.
Nobody wants that pity.
Yeah. Yeah. Yeah.
Yeah.
Well, that's real. Okay. Wow. Okay. So with these patients, or with the way you guys sell, is this largely patient driven? Like, doctor, I want this, or is this primarily the doctor saying, hey, let me tell you what some options are as you start to experience what we're going to do?
Right. So patients will do their own research. They'll learn about scalp cooling. We get tons of inquiries,
Okay.
but ultimately it has to come from the clinic, the physician,
Mhm.
right? So the infusion center owns the device. They have the device at their site. So when the patient's diagnosed, that's when they would be informed about their scalp cooling option.
Okay. Okay. So talk to me about, I mean, this is the Medical Sales Podcast, and we're talking about sales reps.
Yeah.
Talking about these sales reps. What type of sales reps are you guys actually attracting? What sales reps have seemed to really thrive in this type of environment with this type of sell? Talk to us a little bit about that.
Yeah. When we first kicked off and added to our team, we hired senior sales reps. And when I say senior, people who they've sold in capital environments, they've sold in disposable environments, they've executed programs. And that's when I say programs, they've executed, like, for example, a lung cancer program. They've executed now a scalp cooling program.
Sure.
They know the layers it takes for all these different sales scenarios. Like anything I feel in medical sales anymore, you're talking to multiple people. It's no longer you have one decision maker.
Right.
And that is so true with scalp cooling. There are so many people involved, not only as the oncologist, but we have nursing leadership, because this impacts nursing flow. or they think it impacts nursing flow. The nurses are the ones who are seeing the patients, are asking about it. Nurse navigators are involved. We have cancer center directors. So there's a lot of players taking place. So when we first hit the ground running and hiring individuals, we had senior reps who could do that. So since then, we have elevated those senior reps. They are area vice presidents, and we have hired individuals underneath them who act as more of the feet on the street on a daily basis. They're in there. Yeah, they're running around, they're finding new opportunities, they're growing the existing accounts. And those individuals, they're newer to the space. They've been in the industry for 1 or 2 years, and some are brand new altogether.
I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. What's the biggest challenge when selling this?
The biggest challenge when selling this has been reimbursement. It's been a big component, right? So there's hurdles we have to go around on the reimbursement side. And secondly, it's not, people look at Scalp Coin and say, it's not keeping them alive, right? It's a nice to have. But in reality, the mental game is just as much.
Amen to that. Yep.
As, the medicine that's keeping them alive. So there's 2 philosophies on that, I would say.
Okay.
I think it's the whole package.
Okay. So what was your title when we talked last?
Last, it was VP of Sales.
And what is your title today?
Global VP of Sales and Marketing now.
Okay. So,
yeah.
What I love about talking to you, Courtney, is, you started at the bottom, right? You were a startup once.
Yep.
You did your thing with biggest companies. Then you did your thing in the startup world just to see what would happen. Then you established yourself in the startup world, and now you're literally a global leader. Let's talk about it. Besides the obvious, because in the beginning, you just had to figure out what to do, right? How do we sell this product? How do we get traction? What does it need to look like? But then you started getting some people, and you were managing them and telling them where to go and what to do. Now, with over 20 reps, I'm sure it's changed even more. What is the difference now? What is your focus now compared to what it was maybe a year ago?
We're still figuring a lot of that out, Samuel. When I first started here, I will say it's probably one of the hardest things anyone will ever do. When you're not a reputable company, when you're not recognized, when you don't even have a customer yet, Samuel, but you have to go in and try to sell your product to someone, that is really freaking hard. Now, when I look at my role and what I'm doing is we're building culture, right? We are building culture. We're building a place where people can thrive on something for themselves, but also as a team driving towards this mission that we're working for together. That's what excites me. That's powerful. And making sure you hire the right people so you're not micromanaging them, right?
Yeah.
I am not I've never enjoyed being micromanaged. Yeah. Honestly, I've never lasted anywhere where I've been micromanaged.
Fair.
So hiring the right people who we know can execute, I, myself, and my AVPs give them the direction to thrive.
So if you could give advice to anybody listening, we have a lot of people listening. A lot of them are in the field. A lot of them want to be in the field, and a lot of them are leaders of industry. But some people are out there that are saying, I want that trajectory. I want the Courtney trajectory. I want to, I'm in the field now, or I want to be in the field, but I want to give it however many years, and I want to step it up into startup and then really take that somewhere. What would you advise them to focus on?
Number one, I advise them to focus on their strengths. Samuel, you know, I'm a huge believer in knowing what your strengths are, because if you can identify your strengths, you can start to hone in on your superpowers. I like to direct everybody to the Gallup Strength Finder because I just think it's super simple. And when you take that, you don't have to be part of a corporation. Go online. It's, I think, $59. It'll be the best report you'll ever get, and focus on those top 5 strengths. Not only will it share where you thrive with those strengths, but it will also share with you those pitfalls where those strengths overpower you and can become a negative.
Okay. Okay. And then, you know, to go from secure W-2 to startup when I have no idea what's going to happen, I mean, that takes a lot. And for someone that hasn't done it, I don't even know what goes through their head. But because you have, what would you say you really need to consider before making the leap? Or what would you say you should consider that kind of pushes you to make the leap? How would you advise that?
Number one, it's a risk. Any startup is a risk, especially in this day and age. You got to know that there is the potential for wherever you're going for the doors to be shut down tomorrow. I'm being a little bit more exaggerated on that, but you want to understand that no, you're not going to be sitting there in the comfortable seat from the day you start to the day you end. Everybody is wearing multiple hats. Titles don't matter. So I do what my reps do. My reps do what I do many times. Like, I was out in the field this week helping in one of my reps.
Sure.
Right? So if you're going in there with an ego to a startup, you're not going to survive.
Looking at the door.
Yeah, check it at the door. Be done. So know you're going to take a risk. But if the product excites you and you're passionate about it, that's what I would really focus on.
Okay.
And the leadership, the team that you're surrounded with. So those two components, that's going to tell you if that company is going to hopefully thrive.
What about some of the logistics, like how much you should save, or what things should you make sure are already in place, or those little things before you make a leap like that?
Well, so I'm not a 1099. No one on my team is a 1099 rep. They are all direct employees.
Sure.
Know that when you go to a startup, typically there's not a 401k. They have a 401k, but it's not going to be matched.
Mhm.
You're getting more on the equity side than you're getting in those comfort securities for the
Sure.
company.
Sure.
There's just an energy about a startup, Samuel. I think that's the best thing.
Mm.
Are you okay with change? Are you okay with taking a risk? Know that you're going into it not knowing what tomorrow will bring. But as long as you're passionate and you're working with great people, it'll be worth your time.
So on that note, was there a time with Cooler Heads in the past 3 years where you weren't sure about tomorrow? You were working hard, you guys were doing your thing. Things were not bad, but they were very uncertain, and you had your doubts and you pushed through anyway. Did any of that happen in the past 3 years?
Of course.
Okay.
I think that happens in any job you're at, Samuel.
That's fair. That's fair.
Right? I mean, I think everybody, being in medical sales is the biggest emotional roller coaster ever, no matter what level you're at. There's
Sure.
highs, there's lows, there's the in between. But when you're in a startup, let's be real. We're in the process of closing our Series A.
Yeah.
But there are days like there's a chance that we weren't going to make that money.
Sure.
So yes, that brings uncertainty, that brings question, that brings fear.
So then my next question is, think about a time when it was dire in the past 3 years and you were like, I just don't know. And I want to hear, we all want to hear, what allowed you to push through anyway? Was it well, I have nowhere else to go, so I have to try and go forward? Or was it something else? Or was it leaning on a higher power? Or was it your family? I mean, when you were in that moment of who knows, what gave you that energy to say, we're going to give it our all anyway?
For me, when I'm in that moment, number one, I lean on the people around me. I'm big on support system. I'm big on community. That's a time when you really need to use your mentors. You need to also use your confidants. Talk through it. Number two is your mindset. Where's your mind at? Do you have the capability to stay in the right headspace during this time? Because if you aren't, then you need to look somewhere else, but you need to check your mindset always. So for me, during those times, I don't allow myself to dwell
Sure.
in the dark much. I'll have my days, but I am positivity is one of my strengths. So if I find myself my energy and my positivity going down, I start to, again, surround myself with people, listen to podcasts. I'm part of a great community called the Outlier Project. I surround myself with top achievers and people who are always checking or pushing the boundary because it just keeps you elevated through the process when times are tough.
That's key to know. Do you have any specific moment you can share that it was just a scary time?
The biggest thing is here. I mean, besides my Shark Tank company, this is the rawest startup I've been part of.
Okay.
Definitely the rawest startup I've been at for a medical device company.
Sure.
And yeah, there are moments that this Series A could not close. It could fall apart at the last moment, Samuel.
Sure. For those listening that are unfamiliar, break down in as simplistic way as you can the importance and the value of the Series A.
The importance and value, number one, for Series A and medical device, currently they want to see existing sales. We had that check. We had some great accounts, right? So a big also tipping point for us was that Medicare, we're shifting to CPT-1 code. So not only did we have great sales in place, the insurance reimbursement was definitely a game changer. And, you know, I'm not the CEO, but I know my CEO, Kate Dilligan, there were many moments, it was a lot for her. And my job as a commercial leader, let's put it that way on the sales and marketing side, is to keep my team focused.
Sure.
It does no one any good to allow them to get scared and be in that fear mindset.
Yeah. By something they
Right.
can't even control anyway. So
Exactly. Control or controllables.
Yeah.
And that's what we have to focus on.
Wow. This is amazing, Courtney. You know, when you think about the future, when you think about the next 3 years, what are you hoping to see?
What do I hope to see? Well, I hope to see big things for Cooler Heads. I know there's going to be big things. It's already happening. Like this first half of 2025 has been off the charts for us. And I'm super grateful for everyone on my team for that reason. And in the next several years, I look to us to be acquired by a major medical device company. That is what I'm putting out there. The sky's the limit.
So when that happens, what's next for you? Do you plan to stay, or are you going to on to the next thing?
You know, I'm an entrepreneur at heart, Samuel. I really enjoy the startup world, but I have a passion project on the side, which is my podcast, and which is called Bold Moves, Confident Choices.
Okay.
And that is where I get to help others shine and show other individuals that you can do whatever you put your mind to. You just got to take the bold move, the big step, and be confident in yourself, and the sky's the limit.
Confident choices. Is this a podcast that's interview style? Is it yourself, or what is it?
It's interview style. I have some independent episodes coming up, but it's leaders and entrepreneurs sharing their biggest aha moments of when they took that bold move and how it catapulted them to the next level.
I love it. You know, one thing I want to highlight before we wrap things up, you did mention that you're part of an outlier group. You know, you're one of your strengths is positivity. I don't think people talk enough about a leader like yourself going through the hardships of your business and the things outside of your business that kind of remind you why you keep going, give you that energy. Talk to us a little bit about that. You know, what do you, how can I say it? How necessary do you think it is to have some kind of regimen or routine outside of your work that's giving you that energy to push through?
I think it's imperative. For me, it's my morning routine. My morning routine is sacred to me, Samuel. Even if I'm traveling, there is a routine in place that gets me focused for the day. It gets my mind and my body clear and ready to stay focused. Number two, I think for me, and I actually encourage everyone to do this, is to look for those communities. Look to people who elevate your game, right? They say you're some of the people you surround yourself with.
Sure.
There's something to that.
Yeah, I believe it.
Because they're challenging status quo, which makes you want to challenge status quo. So get involved on LinkedIn. There's amazing people sharing great insights. People love to connect off LinkedIn. I never realized I'd have so many friends from LinkedIn, and I have a lot. You, Samuel, I met you on LinkedIn, right? This is one right here. So that's a great starting point. Start on LinkedIn. DM some people you admire or who inspire you. More than likely, they will have a coffee chat with you.
I love it.
Get connected. People love to talk about themselves. So to ask to learn about their story, they will have a coffee chat more than likely. But go learn from the people in that community. It's a great place to start if you're looking.
I love it. Anything else you'd love to share with the audience today, Courtney?
Samuel, I just want to tell everybody to go be bold, be confident, and be yourself, because you will shine. You have something unique to bring. And know if you need anything, reach out to me, DM me on LinkedIn, best place to find me. And Samuel, thank you.
Absolutely. We have one more thing before I let you go, and it's called the lightning round. I'm going to ask you 4 questions. You have less than 10 seconds to answer. Courtney, are you ready?
I'm ready. I forgot about this, Samuel.
All right.
Here we go. Let's do it.
First question. What is the best book you've read in the last 6 months?
Best book. I'm going to tell you, I don't read books, Samuel. I actually believe that I have some dyslexia in me. I listen to the Mel Robbins podcast.
Okay.
There we go.
That works. So the best podcast you would listen to, the Mel Robbins, is that the one?
Yeah.
Okay.
I listened to one on mindset this week on my airplane and took notes.
Okay. Received. What is the best TV show or movie you've seen in the last 6 months?
Oh my gosh. It's the one on the beach with the I've already lost on this 10-second round, Samuel.
No, it hasn't been 10 seconds yet. You still got like 3 or more seconds. Go ahead.
Gosh, it's the one where it's the 3rd season of it.
Oh,
Yeah.
Okay. Folks, that will be in the show notes. We will get that.
Gossip Girl is the biggest series I just watched. Let's put that one.
Okay.
We'll say Gossip Girl.
All right, there. 3rd question. What's the best restaurant you've been to in the last 6 months? We want the item, the restaurant, and of course, the location.
Oh my goodness. I was in Puerto Rico. I don't know the name of it. It was by our Airbnb, but my son and I shared a full red snapper fish, and it was to die for.
So a great restaurant by the airport in Puerto Rico.
No, by our Airbnb. I'm sorry.
Airbnb in Puerto Rico.
Yeah, okay. We are in Rio Grande.
Rio Grande. Okay, we'll get more on that too, folks. And then last question, last but not least, what's the best experience you've had in the last 6 months?
The best experience was I went to a retreat with a bunch of people from the Outlier Project, and it was everything I needed for my soul. I met some incredible people all across the country, and now they're some of my best friends.
Hey, come on. Couldn't be said better. Courtney, thank you for the time. We can't wait to see what you continue to go on and do with Cooler Heads.
Thank you so much, Samuel. Happy to be here.
Absolutely. And that was Courtney Turich. Wow, good stuff. You know, it's always amazing to see someone start from ground zero and literally take things to all new heights. I mean, from where we were more than 3 years ago to the Series A conversations and potentially being bought out now, it's unbelievable. To having management over 20 reps plus, it's unbelievable. It's been an amazing thing to watch her growth. And this is the kind of thing that we live for, right? The Medical Sales Podcast is about bringing these kinds of stories to life, right? People doing amazing things in amazing spaces, people starting from nothing and making them something, people that are changing lives each and every day. As always, we do our best to bring you guys who do it differently in the medical sales space. If you're listening to this and you're thinking, I want to be in medical sales. I love the stories I hear. I love the impact these people make on patients. I want to do this. Then you already know what I'm going to say. Make sure you visit evolvesuccess.com. And if you're in the industry and you're thinking about how you can be bigger, be bolder, do more, make a bigger impact, then again, make sure you visit evolvesuccess.com. We now have a school community where we're bringing everybody together, people that want to be in, people that are in, recruiters, hiring managers, leaders of industry, in the same space, having real conversations to help you get to where you want to go. Last thing I'll say, you love this podcast, you get value, you listen, then make sure you subscribe. These episodes happen every single week to bring you value, to teach you things you don't know and things you do know, and reinforce why it's important for you to clearly understand. Again, thank you for listening, and make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolvingsuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.